Let's explore an important distinction in hypertension: hypertensive emergency versus urgency, both present with severe blood pressure readings, often over 180 systolic or 120 diastolic. But it's the end organ damage that truly sets them apart. In a hypertensive urgency, you might notice symptoms like headaches or anxiety, but crucially, the heart, brain, and kidneys remain intact. Treatment is usually oral and managed on an outpatient basis, aiming for a gradual blood pressure reduction over 24 to 48 hours with options like labetalol or clonidine. Rapid pressure drops can be harmful. On the other hand, a hypertensive emergency indicates end organ damage, leading to critical conditions like encephalopathy or aortic dissection. Here, patients require immediate ICU care with intravenous antihypertensives and continuous monitoring. Key agents include labetalol, nicardipine, and clevidipine. In emergencies like a dissection, the goal is to lower systolic pressure to under 120 within minutes, while for others, a careful reduction of mean arterial pressure is vital. So the next time you see a reading of 190 over 115, pause and consider, is there end organ damage? This question is essential for guiding treatment.